The government is shut down and millions across the country are already feeling the effects, from federal workers missing paychecks to families worried about vital programs being put on hold. Congress at a complete stalemate over how to fund the government. Republicans argue reforms and spending cuts are needed to address the national debt and border security. Democrats say that they are trying to safeguard health care and education and climate programs. Americans are the ones caught in the middle, and here in Washington, the impact hits very close to home. Joining us to sort this all out is Washington Congresswoman Pramila Jayapal. Thanks so much for being with us.
You bet, Joyce. Great to be here.
Before we get to the shutdown, I want to talk about the threats against you and what that must feel like in this political climate.
Well, it's quite horrible. I've had death threats, as you know, before. I've had a man with a gun show up at my house. I've had to move homes. But this, Joyce, is an elected Arizona state representative calling for me to be hanged. And we have been pushing back hard. The backlash against him is severe. And just today I saw that a network of 30 or 50 statewide organizations have called for him to be expelled. I'm looking at whether there's an investigation at minimum that can be done into him. But this is outrageous. It is dangerous. It is a rise in authoritarian behavior when you call for, one elected official calls for another elected official to be hanged. And ironically, Joyce, it's all because I do these nonviolent trainings called Resistance Lab that go through Dr. King's principles of nonviolence and how to fight back against an authoritarian, excessive leader with nonviolent action. And it's been very successful. We've trained over 15,000 people in all 50 states. People can check it out at resistancelab.us. It's because it's successful that I think they're targeting me. And I'm going to continue to take care of my safety and also to not allow this to be normalized. I don't think we can normalize
is unacceptable at any level.
Unacceptable. Absolutely unacceptable.
Please keep us apprised of what you're doing with that, and we just want you and all of our lawmakers to be safe, as you should be, and hopefully you'll get the protections that you need. I want to turn to this government shutdown and what this means. As you know, the White House is blaming Democrats. Republicans have full control from the White House to Congress. So what's happening here?
Well, what happened is Republicans control the House, the Senate, and the White House. They have all the power. If they had the votes that they needed to do whatever they wanted to do, then they wouldn't need to negotiate. But the fact is that they have to negotiate to get enough Democratic votes in the Senate to pass a bill that keeps the government funded. And what we have said is we would like to keep the government open, and we want to make sure that we stand up for the healthcare people, because their big bad betrayal bill cut 15 million people off of healthcare, set that up. But now, in the next 2 weeks, premiums are going to rise for all Americans if we don't extend the ACA subsidies, the Obamacare subsidies. And so we are saying cancel the cuts to healthcare that you made, lower costs for the American people, and save healthcare, because they've been slashing agencies unconstitutionally, illegally. They've been firing. They already fired 150,000 federal workers. They're now threatening to fire another 750,000. And Joyce, they have just canceled, I was just looking at the numbers, $1 billion of federal funding for Washington state and additional dollars for other only blue states who they say are blocking them from being able to reopen the government. They have all the power. They should be able to govern. They should negotiate with us. And we Democrats are going to continue to stand up and fight for the American people to have health care. That is core to what we have to do.
What is your message to families worried about losing their health care coverage or potential skyrocketing costs? In some cases, I understand those costs could double.
That's right.
What's your message to them if they're worried about that?
My message is we are standing up and fighting for you. We're not going to let that happen. We're going to keep demanding that if they want our votes for this, that they cancel those cuts and that they pass these extensions, permanent extension should be, to the Affordable Care Act so that we keep healthcare costs down. That is exactly what our message is. We are fighting for you, and we're not going to give in, because this is the only leverage we have to push back against the horrible things that they have done that have increased healthcare costs for Americans across the country.
I'm sure you heard Caroline Leavitt, the White House press secretary, say yesterday that this is the same bill that Democrats voted for back in March, and 13 separate times when Democrats had the majority. So what is different this time around? Because also from the White House yesterday, we heard that what Democrats really are trying to do is to cover health care for, quote, illegal aliens.
Yeah.
That's what they said.
First of all, that is a complete ridiculous lie. Undocumented immigrants don't, and we could argue in a different broadcast about whether they should or not, but they do not currently have any access to the Affordable Care Act, period. They can't even buy into the exchanges. And there is nothing the Democrats have proposed to do that. What happened is they are trying to blame this healthcare crisis on undocumented immigrants, on immigrants as a whole. And so that's just a lie that they keep telling. It's not true. It's a way to distract people from the fact that they're trying to strip your healthcare away, and they'd rather shut down the government than provide healthcare for the American people. Now, the other piece, we did not vote in the House, if you remember. All the Democrats opposed that spending bill in the spring because it was a partisan spending bill. It was not a clean continuing resolution. That would have meant that funding levels stayed the same. What they did in that bill is they cut funding levels substantially. Now, that time they got the Senate to agree. They kind of bullied Senate Democrats, and enough of them caved. Schumer caved, and you know how I feel about this because I haven't been silent about it. This time, but then they went back, and things that had been agreed to, they passed a rescissions package, and unilaterally, just on a uniparty vote, they rescinded money that had just been agreed to 3 months ago. And they went and slashed a whole bunch of federal agencies and fired workers that they shouldn't have done. So at this point, we're saying we can't trust you. Promises made, promises broken. That's what you do, Republicans. And this is not a clean continuing resolution. If it were, it would restore the funding levels that we had the last time around. And then the last thing is, yes, we voted for continuing resolutions in the past because Democrats keep our word. If we say we're going to do something, we follow through. But now this is multiple times where they have promise something and then refuse. So we need an ironclad agreement that even if we get to a negotiation, which includes the health care we know Americans deserve, that they're not going to just break their promise right after passing this and rescind.
Meantime, we are in a shutdown. The vice president yesterday talked about potentially people losing their jobs. I just want to roll this very quickly and get you on the other side of it.
Let's be honest. If this thing drags on for another few days or, God forbid, another few weeks, we are going to have to lay people off. We're going to have to save money in some places so that essential services don't get turned off in other places. That is the reality of the government shutdown that Chuck Schumer and the Democrats have foisted upon the administration.
Should people be worried about losing their jobs?
Well, they have to be with this administration. They already fired 150,000 federal workers. Now they want to use the shutdown to fire another 750,000. They are even using government websites in violation of the Hatch Act. And they're not supposed to be partisan, but they are putting out partisan messages. We even had a constituent reach out to us because we believe this person is reporting that they had their auto message changed automatically to blame Democrats for the shutdown. This is all in violation of the Hatch Act. So they are trying to do whatever they can to distract the American people from the fact that they cut health care, and we are standing up for Americans' health care. That's what and they're trying to distract people from remembering that it was the billionaires who got $7 trillion of tax breaks so that they could cut Americans' health care.
But in the meantime, during this shutdown for federal workers, we have 80,000 federal workers just here in Washington, more than 750,000 across the country. And then today we saw in a social post from the president that he's going to connect with Russ Vought, who was one of the authors of Project 2025, which the president disavowed multiple times during the campaign.
Now he's claiming it.
But now he's going to, as he says in this tweet, meet with him to look at what Democratic agencies can be cut and if those cuts can be made permanent. So how concerned should we be about that? This sounds like a sure thing. Like jobs, we're going to lose jobs, more federal jobs.
I mean, look, I think it's all about the American people fighting back. I really do. I think it's about Americans across this country calling their Republican senators and their Democratic senators and saying, don't give in, because this is what they do, regardless of whether they get our votes or not. They are implementing, I think you should hold it up again, Project 2025. This is all in there.
It's a fascinating read.
To destroy all of our federal agencies that support people. Look, the Big Bad Betrayal Bill had a $500 billion cut to Medicare lined up in there.
Half of the country is fully behind the president, supporting cuts, supporting this bill, and also supporting bringing federal troops into American cities. Portland, 200. National Guard called up just this week. Many believe Seattle is going to be next. Half the country is behind these policies.
I don't think so anymore. I think half the country half the voters may have voted for Donald Trump.
I'm glad you said half the voters, because millions did not vote.
90 million Americans did not vote. And so for a whole bunch of reasons, because they're disgusted with the way, both parties
Washington's not working. This is a perfect example of that.
Yeah. So, but his approval ratings are in the tank on everything from immigration and the kidnapping and detaining of immigrants on our streets, the militarizing, using U.S. troops against U.S. citizens on U.S. soil. This is unheard of.
And yet these troops are rolling in.
They are, but I have to tell you that the continuing tanking of the ratings and the work that Americans are doing to nonviolently stand up and fight back against what is happening is probably the single most important thing to do in these authoritarian situations where institutions get taken over. Congress has been taken over. They're essentially a cult party now and pledging allegiance to the king.
I have to ask, though, what do you say to people who believe that crime is really out of hand and they are on board with bringing federal troops into cities like Seattle? There are people, it may not be the majority, but there are a lot of people worried about crime and think that this is a good move. What do you say to them?
I say to them that I think it's really important that we make our cities safe. And there are ways to do it. And my belief is that the way you do it is you invest in making sure that people have the supports they need, that they are taken care of, and that we continue to, like, for example, I got $2 million for the CARE program here in Seattle, which helps local law enforcement to work with support agencies so that it's a joint partnership. Law enforcement doesn't want to take care of all the things that happen on our streets that have nothing to do with crime. They want to focus on what they were trained for, which is crime. But we need some supportive services around us. We need more housing, Joyce. This is really important in Seattle. We need mental health. We need a whole range of things, and we need trained people to do that. So that is what the CARE program is. That's why I got federal dollars for it. It's what law enforcement wants. It's what our community wants. Those are the kinds of things we should be doing. But bringing in the National Guard, and I've talked to a lot of guardsmen who are also privately horrified because, the National Guard has a great profile, right? The National Guard protects us during these emergencies. They help us with recovery.
They live among us.
They
live
neighbors. Among us. They're our neighbors. They're not being paid for this stuff, right? They're not, I mean, it's really, and I think that they are kind of horrified that they're having to play this role, and obviously they're following their orders. Right. But I think it is a real disservice. We just had a shadow hearing on immigration, but we had somebody who is a National Guard's representative come and talk to us both about our veterans and our current serving members and how horrified they are. Some of them are having their families picked up on the streets.
Yeah. That's right.
Some of them are immigrants, right? I think that what I say to people is, look, we can deal with safety. And I think Seattle, our crime rates have been coming down. We've had a lot of success. I think that's true in Portland. That's true in many places. And we've got to make sure we do those kinds of things.
In this moment, where do you see room for a compromise? If the government stays shut down for any length of time, American people take politics out of it, the American people are going to be hurt, and in some cases severely. Where is there room for compromise? How long do you think it's going to take to get back to the table?
I don't know how long, but I can tell you something. Democrats were there all the way. I just got home yesterday after the government shut down to be with my constituents.
And I hear you, and every Democrat's saying that. But where's there going to be a crack?
They sent all of their people home. Yeah. So the first thing that has to happen is they have to understand that they need to negotiate. They have to come to the table because we are not going to sacrifice the health care of the American people. And we even have federal employee unions who have written to us and said, stand strong, because even if I keep my job because the government reopens, if they slash my Medicare and my health care, then I can't afford it anyway. So I think this is a very complex thing, and what I would say to all of my constituents is we are looking out for you. Our office is open, so anybody that needs help can call our office, and we will do everything we can to make sure that we help you, because we're staying open during the shutdown, and we're going to keep negotiating to make sure that we save people's health care, that we cut costs, and that we restore the cuts.
Congresswoman Pramila Jayapal, we so appreciate you coming in to walk us through what's happening right now in our country. We really, really do appreciate you. And we want you all to know that our coverage continues on King 5 Plus and king5.com. You can see this entire interview again. You can also see a portion of it coming up on King 5 News at 5 o'clock.